Hi, it's Dr. Weiner, and I'm going to show you how I fill temples and the superior brow using Restylane Refyne, which is right over here. Restylane Refyne. Using blunt cannulas, 23 gauge cannula from Soft Fill. I like to use large cannulas for this area because the vessels tend to move away from the cannula rather than the smaller cannulas, which act more like needles. So anyway, she's already been prepped with HIPAA. I'm fastidious in regards to that. And I make a little pilot hole. And I go right into the pilot hole. And you gotta go very slow and methodical with this area because there are vessels here. And so now I'm right up here. I'm in the superior portion of the orbit, supraorbital area, I'm sorry. And there's often a fat pad that's missing in this area. So you gotta fill it. By filling it, you give a little brow lift as well. And so you give a little aliquot and you smooth it out. And then you march it around a little bit. And you're underneath the vessels. Make sure you're underneath the vessels here. And giving little aliquots lifts the vessels up, and then you can advance it a little further. And usually this area takes between a half a syringe and a full syringe. And why don't you come? You got a good view of it? Okay. So the beauty of doing a superficial injection with hyaluronic acid is that it really gives a great lift to the temples. If you go deep with Sculptra, which I have done for years, it just needs a ton of product to get you to where you need to be. And so I often will fill deeply with Sculptra and then go more superficially with an HA. And we're almost done here. She doesn't need as much on this side as she did the other side. But we're at like 0.7 right now. And make sure you go to the hairline. And notice that I'm constantly moving because that avoids any vascular injury. And I'm almost done here. And I go very gently. And it's very safe with cannulas, particularly the larger ones. So that is about 0.8 of Restylane Refyne, done bloodlessly and without any anesthesia whatsoever. And we fill the superior orbital area.